Okay guys, so today I'm going to be talking about anxiety. So if anyone has ever experienced anxiety or just had anxiety, you know what it feels like. According to Dr. Neenan and Dr. Dunlop, anxiety has 4 dimensions, and really it's like best described as like angst or apprehension or even like nervousness like I am right now. So anyways, good topic. So first I'll be talking about different anxiety disorders and like medications you can take to help. And then I'll be talking about mindfulness and the effects that it has on anxiety. And then I'll talk about how to help someone through a panic attack or an anxiety attack. So anxiety affects a lot of people, and there's different anxiety disorders. The most common type of anxiety disorder is probably social anxiety, according to Dr. Neenan and Dr. Dunlop. They are both behavioral psychologists, and they are also university professors. There's also OCD, which is a different type of anxiety, PTSD. Let's see, what else is there? And then there's specific phobia and panic disorder. So this tells us that these anxieties can be triggered by different things. Social anxiety would be triggered by social experiences. You get more triggered talking to people. And then OCD is obsessive compulsive disorder, when you have just tendencies to just do things to get you through your daily habits. And then they all have different things that can trigger them. But there's alternative medicines you can take to help these. So I have some pictures of some medicines that you can take to help. So valerian root, that kind of helps people who have OCD, because it just helps relax them and helps as well with depression. And then there's, and St. John's wort. St. John's wort also helps with OCD, which is just they're just roots from plants, kind of. And then kava, that's helps with social anxiety, and it's derived from a root from Polynesia. And the last one was acupuncture, which helps a lot with post-traumatic stress disorder. These are studies both done by Dr. Dunlop and Dr. Neenan. So now that we've talked about the medications you can take for anxiety, we'll get into mindfulness. Mindfulness is like a meditation that you can do, and really it's one of the most common ways to relieve stress that people can use without taking medication. According to Dr. Hong Yi, who did a study on mindfulness meditation, people can focus if they're in a stressful situation, if they can tune into their mind, and sounds really weird, but if they can tune into their mind, you can really learn to be in tune with yourself, and your anxieties can just go away. There's an app, if anyone wants to download it, where you can practice a mindfulness trick, called the Calm app. So when the presentation's over, we can all, if you would like to download this app, it's called Calm, and it just really walks you through mindfulness techniques that can help you. And according to a study that Dr. Hong Yi did, it says that, that the group that did the mindfulness study reported that they had a decrease in anxiety, and the group that was the controlled group that didn't do mindfulness and practice these, their anxiety actually just worsened. Okay, and so the last thing that we're going to talk about is how to help someone through a panic attack or an anxiety attack, which could be panic disorder. So according to the Mental Health First Aid Organization, some symptoms of a panic attack would look like shaking, numbness in somebody, sweating, shortness of breath, chest pain, and then they might feel like they're gonna die or like they're going crazy, and then heart palpitations. But they also say that these could be symptoms of cardiac distress, so also be aware of that if they're like panicking like that. But ways that we can help these people are just assess if there's any like risk of harm first, so make sure that they're okay. Ask them if this has happened to them before or like what they do, and then always just listen to them, listen to what's happening. Don't try to judge them or don't try to say anything like to like calm them down, just listen to them. And then after that, you can give them reassurance and just tell them like everything's gonna be okay, and just maybe that it'll pass. And then you can just help them talk about like professional help or maybe about some of the medications you learned, but always just tell them that they can go to a doctor or they can get different kind of help. Another thing to look out for is not giving someone with a panic attack a bag, because that can cause them to have like worse, like go into hyper, I don't know what it's called, but it'll just make them worse. So don't give them a bag. And then, so just going over all this information, like now we know that we can just like manage our anxiety in different ways. We don't have to just feel like we're always anxious. There's things we can take, and we can practice mindfulness, and like if anything, you can always consult a professional, and just always feel like